My name is Gabi. I work in public health, and today I'll be touching on the theme for mental health in an unequal world. World Mental Health Day is happening on this Sunday, and the theme for this Sunday is mental health in an unequal world. I think this is a great opportunity for us to reflect on the barriers that prevent communities from accessing mental health services. It's also a good chance for us to explore what mental health looks like across the world with the pandemics. So some countries are still in the lockdowns, and some countries still have not received the vaccinations either. So today's focus, I won't be specifically talking about Leeds, but I will try my best to dip in and out to make it relevant to what's going on in Leeds today. Not everyone has the same access to the resources that gives you the chance to improve the quality of life. So these disparities can be your gender, your race, your geography, where you live, where you are based, your capital, your education. And today I'll be focusing on mental health. I'll be defining what the risk factors are, the inequalities, and how it links together. I'll then explain what mental health looks like in higher, lower, and middle income countries. We know that coronavirus has exposed the fragile elements of mental health care for communities, and in many countries today, it is largely absent. So this will be having a knock-on effect for generations to come. Before I close for questions, I'll also share what countries are doing to challenge the stigma and what they're doing to provide mental health care to communities with very, very little resources and what we can learn from them. What is mental health? I'd say mental health and mental well-being is about the way you think and feel every day. Some days are good, some days are bad. I'd say it's a sliding scale. The impact of how we think and feel about ourselves is an indication of how resilient we are. So this can be influenced by lots of protective factors such as your health, your employment, your housing, if you're in a good relationship with your family, if you are feeling fulfilled, if you've got a good job, if you've got money, and yeah, just like overall, just how you feel, who you interact with. So one example, recently, I was supposed to be living with a friend, but then that fell through, and I had just 10 days to look for a flat by myself. This was very, very stressful, and I felt like I couldn't really concentrate until I knew I had something, sorted. But under all of this stress and anxiety, I just knew that, I just had to keep telling myself to keep going, that it's going to be okay. I had friends, I've got families, I've got a good support system, I've got a job, I've got money, I've got hobbies that will keep me distracted. And I just knew that the bigger picture, things will be okay. And I did find a place. I'm moving into a flat by myself on Saturday. I've never lived by myself before. I'm feeling quite nervous, quite excited. I'm also quite curious about what the challenges are lying ahead. But I also know that if things get a bit tricky, I know I can ask for help. I know that it's okay to have like bad days. And yeah, just I think this is a good summary of what I think mental well-being is and what mental health is. However, for many people, negative feelings such as stress, anger, sadness, emptiness, and numbness can persist longer for 2 weeks. This can have an impact on people's ability to complete day-to-day tasks. So some of the most common mental health issues I would say are anxiety, depression, and the signs can look like eating more or less than usual, withdrawing from friends, feeling low, feeling numb, feeling irritable, thoughts about self-harm and suicide. And sometimes mental health problems can be rooted in inequalities such as unemployment, trauma, abuse, loneliness, digital exclusion, debt, and addiction. And not being able to cope can cause issues to your confidence, leading to clinical diagnosis. Beating yourself up about not being able to cope with really challenging issues is rooted in stigma based from society today, just about how we see mental health. After lots of horrible life experiences, many people are just told to just suck it up and get on with it, rather than accepting that things are really hard and it's okay that it's hard right now. So there are many determinants which determine our mental health experience, such as experiencing abuse, discrimination, employment, poverty, parenting. And so when I use the term inequality, this is referring to differences in health across the population and between different groups in society. So, for example, people from African and Caribbean communities have higher rates of post-traumatic stress due to police brutality, poverty, racism. In Leeds, there's a big focus on working with communities who are more at risk of mental health. So the 10% most deprived areas in Leeds are around Armley, Hare Hills, Beeston, Seacott, Richmond Hill and Middleton. And the communities of interest include Black and minority ethnic groups, unemployed, people who are homeless, people with learning disabilities, people with severe mental illness, gypsies and travellers, and children in care. But the list does not stop here, and there's many areas in the city where health outcomes are very, very poor. The stigma here in these communities are really high, and this is partly the reason for the life expectancy being reduced for 28%. People feel like they can't cope with these issues, and they feel like terrible about the fact that they can't cope with them, and they've got people around them telling them that actually your issues don't matter. However, we're surrounded by great third sector partners, decision makers, volunteers, and of course the communities themselves to further our understanding of different risk factors and how it intersects with the social and economic disadvantages, which then lead to social exclusion. So as we all know, last year, March, coronavirus was officially declared a pandemic by the World Health Organization. So far, we know that this is transmitted through airborne droplets, and the numbers of coronavirus cases are rising steadily in many countries. Some countries have crossed the peak of infection, whereas several others have not. And these infections have triggered a wave of lockdowns and social distance measures, which have had an impact on mental health globally. The main themes here that have had an impact on mental health has been the digital divide, the access to healthcare, the lack of access to green spaces, and just overall accessibility. So when I talk about the digital divide, in the UK, many of us have been fortunate to have access to the internet, and we're able to further our careers whilst working at home. However, others have been forced to work during the pandemic and face illness. Some have lost their jobs, businesses have gone bust, and this has really led to people's mental health feeling going quite down. So in India, 50% of people of the population do not have access to the internet, and in several African countries, this number is much, much higher. So this will undoubtedly have an impact on children's education. Many children have had to stop going to school and could not complete their studies, leaving a generation behind. So this increases the risk of childbearing, child marriages, trafficking, poor nutrition. And the digital divide has also had an impact on adults who have not been able to catch up with the virtual world. So in Eastern European countries such as Turkey, Romania, Serbia, and Cyprus, workers are 48% less likely to work from home. So here we can see that highly educated and skilled workers are more likely to work in occupations where remote working is possible and they're able to further their career during the pandemic, whereas other people are forced into unemployment or debt, or they're forced to choose between staying at home to protect their health or continuing a job, putting them at risk and contracting the virus. So here we know that not having a safety net and fearing for your health exacerbates your mental health. The access to healthcare, there's a lot of risk factors that can impact your mortality if you contract a virus, such as diabetes and heart disease. And in many countries, a lot of people do not have access to healthcare, which paints a worrying picture of the potential lives to be lost during the pandemic. Inequalities have worsened as a result of the pandemic, and access to mental health care is in decline. There's been an inquiry that shows that the reduced access to care will have long-term consequences on mental health and more pressure on the services. Moving on to green spaces. During the pandemic, many people have enjoyed having access to gardens and parks. We know that this has boosted our morale, our mental health. We know the importance of being around life, plants, trees. We know that it feels good to go on walks. We know that it feels good to witness scenery and nature. It keeps a lot of us grounded. However, not everyone does. So, for example, in South Africa, urban areas which are resided by white residents are 10 times more likely to have access to green spaces in comparison to Black people living in overcrowded conditions. So I've given a bit of a basic outline of what the risk factors are and what mental health is. And I'd like to hear your input on which countries you think would be more likely to have better or worse mental health and why.
Our group talked about things like levels of sunlight potentially impacting on people's mental health and happiness, but also most notably social policy, welfare, employment rights, and those kind of things having quite a profound effect. And that if there isn't that infrastructure or that safety, that can impact people in a negative way. We talked about the medical healthcare system in America and how that must have a huge psychological effect to know that you could bankrupt yourself if you become ill, and how powerful things like that are on your mental health.
We talked about the impact of culture and how, so for example, in like the Western world, the priorities generally like things like money and status and having a good job and a nice home, whereas in other countries, or other cultures I should say, the priority is more about family, and like talking collectivist cultures, it's more about networks, and your priorities is about making sure your family and your networks are okay and stuff, and how that's going to impact your mental health differently, because if your priority is your support system, then by default, well, I don't know, it's going to be different to if your priority is something so changeable like money or a job or something.
Hi, our group, we also talked about cultural differences / religion. So for instance, maybe Jewish countries, Muslim countries where they're still against gays, etc. Have a huge impact on people's mental health and obviously seek refuge in other countries.
Just writing it down. But yeah, it seems like culture is coming up a lot. And I was saying in my group, I think the question's a bit hard because we wouldn't really know, we don't want to go into the territory of like generalizing of what other countries are like. But I think culture is a really good starting point to sort of have that discussion of how some people might think about mental health, some people, what people see as mental health, or if it's like necessary or if it's like important. Okay, so this is a graph from the Equalities Trust. It shows that different societies have different levels of mental illness, but it's actually higher in unequal rich societies. So income inequality has been rising in a lot of these countries, reaching levels not seen since the war. So economic mobility is further challenged by a sharper concentration of wealth, which goes hand in hand with the income inequality. However, it's not so simple because this is data from countries that have had the resources to do so. And although countries from lower and middle income countries are not highlighted here, it does not mean that mental health issues are low. It just points to a variety of issues, cultural, taboo, and the methods of data collection. As we know, it's different in every country. Poor healthcare infrastructure means that the budget for mental health in some countries are a lot lower than others. So, for example, on average, countries spend around 1.7% of their health budgets on mental health, but there's a big gap between higher and low middle income countries. So for many higher income countries, the budget allocated to mental health is around 3%. And whilst for developing, it's just around 0.5. So it's just something to consider. So these are some examples of high income countries. Countries around the world use different measures to gauge their wealth. So one method is to identify how much money a person has available to spend on goods and services after paying their taxes. So money per capita can refer to income per capita, GDP, gross domestic per capita. And many of these wealthiest nations are also the tiniest, like Luxembourg, Singapore, and Hong Kong. They also benefit from having a sophisticated financial sector and tax regimes that attract foreign investment and professional talent. Countries like Qatar and Brunei have natural resources and hydrocarbons. What I'm going to be talking about right now is just, it covers this slide and the next slide. So these are examples of lower income and middle income countries. And the GDP, as you'll see on the bottom, this is based on projections from 1,000 investment banks, think tanks, and economic forecasting firms. The 5 poorest countries, which I think is on the next slide, they're all from sub-Saharan Africa due to institutional weakness, corruption, poor infrastructure, and lack of human capital. In 2020, an extra 95 million people were plunged into poverty, and 18 million people today are malnourished. A lot of these countries have experienced political instability, disputed elections, ethnic and religious problems. And if you look at the numbers of coronavirus in these countries, they're a lot lower than in other countries across the West. However, this is due to the poor / non-existent health facilities, and there's still no clear vaccination plan in many of these countries, and the virus is still very present. So sadly, deaths will continue to go unreported. So it's a very mixed picture when we look at high-income countries. Many countries are either market-driven or state-planned, creating either efficient or inefficient mental health care systems. In some countries, it's very expensive and it's very inefficient. And there's also concerns about whether the services are relevant for communities. So these concerns have led to communities just being very distrustful of the healthcare service and also disengaging entirely. There's also the widening gap, the wealth gap. So, for example, in the USA, between March last year and April this year, the top wealthiest fared very well during the pandemic, even more well than the bottom half of the society. And if you're someone working very, very long hours for very little pay, you're less likely to be able to save for a rainy day. You're less likely to enjoy what life has to offer, and you're more likely to borrow and fall into debt, which can then spiral into a cluster of negative issues damaging your mental health. Income, as we all know, is something that's very important, it's very intimate, and it's an indication of your social position, your status. It's something that we talk about in relation to each other. And living in a society where there's a blatant disparity of wealth can be quite damaging to people's self-esteem. The access to healthcare is also another issue. So in many countries, public services are suffering from chronic underfunding, and many people struggle with accessing care due to a lack of awareness, the stigma, long waiting lists, and care that isn't joined up properly. However, in Leeds, there's a lot of work being done to tackle this. There's a huge focus on proactive and preventative programs, more training to have better conversations with communities about challenging issues that's going on in their lives, building trust, and improving the care by making it more personalised and holistic rather than boxing different conditions into different boxes. There's also work being done by the Leeds Primary Care, Leeds Care Partnerships, Leeds City Council, clinical commissioning groups, to make sure to remove barriers for people who are digitally excluded. So one example is the Leeds IUP service. This is a service that provides psychological therapies to people, and they have a very good health inequality strategy based on a peer support model. So this means that service users are also part of the workforce, and this helps make sure that the service is able to adapt to different people's needs. They did a lot of targeted work with Black and ethnic minority groups, and the recovery rates are really, really high. And this happened last year, even during the pandemic. So all of this is from the Health and Inequalities Toolkit, and I've referenced this, and it's really, really interesting. I really recommend you reading it once you've got the presentation sent to you. I've also touched a little bit about the stigma and what that does to people when they want to get help, but they can't. But I think over the past 5-7 years, there's been a lot more conversations around mental health, especially in media, popular media, social media. More and more people are talking about it more. There's more campaigns. One really good example is social media. So young people consume different platforms such as Facebook and Instagram, Twitter, and this allows people to talk very openly about their experiences. There's even online psychologists right now sharing infographics talking about how you can manage your depression, your mental health, the roots of trauma. And another really good example is TikTok. So this is a video sharing platform, and you can upload short form videos as short as 15 seconds and as long as 3 minutes. And many people, especially young people, they're really getting very creative, talking about, you know, dance, comedy, but also education. And yeah, I think a lot of people are slowly starting to open up about their mental health. But I know this is quite limiting because not everybody's on social media, not everybody uses TikTok or Facebook or Instagram, but it's a point. So during the pandemic, there was a lot of misinformation about suicide numbers going up, but we know now that isn't true. The numbers of suicide in higher and upper middle income countries were unchanged, and they were actually lower than expected, especially during the early months of the pandemic. So in many countries such as Japan, Canada, Australia, Germany, South Korea, and New Zealand, they all provided additional mental health support and financial safety nets. And I think this might have alleviated some of the negative aspects of the pandemic. So 83% of the world live in lower and middle income countries, and they've also received a smaller amount of resources for mental health. We know that the pandemic has exposed already a large treatment gap in mental health, and we know that this gap will be widening during the pandemic and after. The fragile mental health systems also go hand in hand with the current context of whatever's going on in different countries, such as social unrest, violence, low workforce capacity. And it's a cluster of these problems that pose a really big worrying picture for the long-term consequences to come. So women with young children living in poverty are more likely to experience mental health issues. So the Lancet Global Health studies show the effect of the pandemic on the emotional well-being on mothers from Tumaco in Colombia. This is a Colombian city with high rates of inequalities, and the majority of the population is Afro-Colombian, and the city was abandoned by the government, leaving very run-down infrastructure, poor social services, high rates of unemployment and poverty. So since the pandemic, the study showed that the mothers have been experiencing high rates of anxiety, depression, and parenting stress, together with the vulnerable feeling of being forgotten by the states. Nigeria, India, Pakistan, Bangladesh, Indonesia, these are countries with very big populations, and here it's a big struggle to enforce social distancing, so more people are more likely to get the virus without knowing, passing on the virus and getting ill, and maybe in some cases death as well. Countries such as Afghanistan, Iraq, Chad, Niger, Guinea, they're all countries with very low literacy rates, and Nigeria, Algeria, and Ethiopia, there's a lot of experiences of unstable political governments, and the hospital beds and the ICU beds, PPE, ventilators, hospitals, they're just, very low on supply. It also goes hand in hand with what the World Health Organization was saying last year, and they said that the pandemic has also disputed and disrupted the critical mental health services in 93% of the countries worldwide. And there's also financial concerns, there's poverty, there's worries about one's health. If your loved one is in a hospital where there's so much unrest going, there's lack of equipment, this can all exacerbate your mental health. Not having that safety net can also exacerbate your mental health. So far it feels quite negative, but I feel like it's really important to talk about the great work that's been done to treat large populations with very little resources. And I feel like over here in the UK, we should try and learn from this and maybe even go one step further and maybe even reimagine our current methods today. So for example, in Bangladesh, there's a tele-counselling service that's been implemented. And there's also been a trial done in Iran. They used a bibliotherapy service and they distributed brochures and literature to support rural communities with their mental health. Some of the key takeaways from this is that they use short sessions to avoid burdening already stressed families. They employed locally recruited counsellors, and they also adopted an empowering approach based on skill and knowledge rather than using the word mental health or mental patients. They also made use of the low-cost technology that they had to provide services to communities, And yeah, there should just be ongoing efforts to integrate mental health into education and employment as the norm rather than as the exception. And we should also continue sharing and collecting data as the effects of the coronavirus long-term are yet to be seen. So to conclude, mental health is a broad term that covers, this is about how you feel, it's about how you think. We know it's a lot to do about resilience, and it can also cover conditions around depression, anxiety, bipolar, psychosis, eating disorders. Experiencing some of these mental health issues is closely associated with risk factors such as poverty, poor housing, unemployment, and experiencing discrimination. That being said, coronavirus, I think, has made a lot of us more aware of these inequalities, either globally or on the doorstep. And mental health issues are common, but it manifests very differently depending on the social, political, geographical, and economic context. So in higher economic countries, we notice a pattern of mental health and access issues in countries where income inequality is very high, where waiting lists are very high, and where people feel very distrustful of doctors and nurses and the healthcare system. The same goes for lower and middle income countries, but actually with countries run by dictatorships, unemployment, and a non-existent healthcare infrastructure. I'd say the main takeaway here is stigma. So self-stigma and institutional stigma seems to be one of the major barriers in stopping people from accessing care. And overall, there's lessons to learn here, but I know that we can't simply just copy and paste the methods that lower and middle income countries are doing, because the cultural context will have a bearing on success rates. But I think now is a really strong time to adapt and test new methods. It's also a good time to reflect on what we could do better. And I think it's really an exciting time. Well, not exciting, it's quite bleak, but I think it's a good time for us to get a bit more creative. And yeah, learning from global mental health will be a really important step in the direction. So I know I didn't really touch on Leeds. I spoke about some examples, but if you want to know more about what's going on in Leeds, my colleague Del did a great webinar addressing ethnic inequalities in mental health, and this has been published. So once this PowerPoint has been sent, you'll be able to hear the goodness that she's talking about and see what's going on and how you can get involved. And finally, so today's slides will be emailed to you, and there will also be a survey sent to you. It'd be really great if you could fill that in. And if you want to know more, please, about like training sessions and other want to know more training sessions, you can go on the public health training website, public health resource library website, and all of the information is there. So I don't want to babble on too much. But yeah, that's the end of my presentation. Thank you so much for being here and just listening. I really appreciate the time and the patience. So yeah, thank you, and I'll speak to you soon.